Good morning, everyone. My name is Sean Kennedy. I'm currently a senior here at Anna Maria College, majoring in paramedic science. I'm also an EMT basic over for Webster EMS. I wanted to talk to you guys about this medication called Norepinephrine, which is under the brand name Levophed. Now, norepinephrine is used both in the pre-hospital setting as well as in the hospital setting in like the ER and the ICU as a critical care medication. Now, some people might know what norepinephrine is. It's a naturally occurring neurotransmitter that is used by the sympathetic nervous system, which is typically responsible for your fight or flight response, reduces your body's alert system, raises your blood pressure, your heart rate, dilates your pupils. Now, norepinephrine is an inotropic medication, which means that it increases the strength of muscular contractions in the heart. It's also a vasopressor, so people who have like profound hypotension, but their blood pressure is systolically lower, in like 60s or lower, a lot of times they'll use norepinephrine to help raise that. Now, the action of norepi is like alpha-1, alpha-2, beta-1 agonist. Now, alpha-mediated peripheral vasoconstriction is the predominant clinical result of administration, resulting in increased blood pressure and coronary blood flow to the heart. Now, the beta adrenergic action produced by inotropic stimulation of the heart and dilates the coronary arteries. Now, some of the indications for norepinephrine is patients who are in cardiogenic shock, septic shock, severe hypotension, and Mass state protocols. If you need to use this in the pre-hospital setting, Massachusetts Office of Emergency Medical Services requires that you use an IV pump. Now, some EMS services do have an IV pump. Here in Webster, we used to. We do not anymore. But I do know a few services that do have it. And I believe it's a very good medication to help patients with profound hypotension. Contraindications for using this medication are patients who have severe blood loss or who are extremely hypovolemic. Patients with severe hypovolemic, you just want to be careful by constricting the blood flow when there's not enough blood. If there's not enough fluid in the tank, you really can't raise your blood pressure. Some of the adverse effects of this medication is that it can cause dizziness, can cause anxiety, cardiac arrhythmias, dyspnea, which is basically shortness of breath, and if you have asthma, exacerbation of the asthma. The dose for norepi can be a little bit tricky. For an adult, you don't want to put this medication, you don't want to draw it up in a syringe and put it directly in the IV line. What you want to do is you want to add 4 milligrams, which is in this, 4 milligrams, and add it into a 250 milliliter bag of D5W, which is basically water mixed with a little bit of sugar. You do not want to put it in regular normal saline. And then how you want to dose it is 0.1 to 0.5 micrograms per kilogram per minute. And now norepi can go through either an IV, which is any IV in your hand, your forearm, your wrist, and anywhere, or an IO, which is when they drill into either like your leg or over into your arm, and you can infuse it that way. You basically want to administer norepinephrine to maintain a systolic blood pressure of 90 milligrams per mercury, but you do not want to go a max dose of 30 micrograms per kilogram per minute. Now, if you want to use this for a pediatric patient, you kind of dose it a little bit less. You want to do a 0.05 to 2 microgram per kilogram per minute IV IO to a max dose of 2 micrograms per kilogram per minute. Now, some of these are very tricky and very small doses. That is why an IV pump is generally really recommended. And in Massachusetts, it's required for use. Some people are not a fan of norepinephrine. I have mixed feelings about it. It's a very potent medication. It's a very strong medication. But when used in the correct setting, it can really help patients. I just want to say thank you so much for everyone for listening to me. And I hope everyone has a good day and be safe out there. Thank you.